Hello friends, welcome to my channel. And if you haven't met before, please do subscribe the channel for further videos. So today we are going to make a video about how to use oxygen cylinder in home setup. We are facing a lot of problems in hospital setup, as most of the hospitals are not taking admission due to COVID positive report missing from a few patients, and that's why we are creating a home setup, and it's very necessary to increase the level of the oxygen. So I have just starting a video which will be very much beneficial, I hope. So at first, if you check that the oxygen level falls in between 88 to 94% in your oxygen meter or SpO2 meter, that is the pulse oximeter, and it's the indication. And in that case, we have to keep the oxygen flow rate in between 2 to 6 liters per minute, and FiO2, that is the fractional oxygen that we inhale, and it can be increased up to 40%. Okay, now this flow rate, that is the 2 to 6 liters per minute. Okay, this thing can be monitored and increased or decreased as and when required. If suppose the patient is having a very good oxygen saturation, even after having it at 2 liters per minute, then we need not to increase it more further. Okay, we can decrease it below 2. So that's what we can regulate and check. And next, if patient is the oxygen level is still not increasing, that means if nasal cannula fails, then we have to put the patient on simple oxygen mask, and the indication for which is it falls below 80 to 88%, and the oxygen flow rate should be here 6 to 10 liters per minute, and the FiO2 can be increased up to 60%, can be obtained here. And in case of severe respiratory distress, even in corona patients or in emphysema or in COPD, we can put patient to the non-breather mask, indication of which is below 80% SpO2. Oxygen flow rate should be 10 to 15%. Again, I am saying that it can be controlled, and it should be controlled according to the patient oxygen level. And FiO2 can be increased up to 93 to 94%. Okay, and even in this case, if the patient is not having much oxygen saturation, peripheral saturation, then hospital setup is needed. The BiPAP can be done. BiPAP can be done. It can only be possible in oxygen and hospital setup, and further intubation can also be done. So this is my short video. I hope it will be beneficial for all of us, that if it's the need of the time that we need to set up a oxygen cylinder in our home, then it will be helpful. That is, again, I am rewinding. For oxygen nasal cannula, maintain the oxygen flow rate in between 2 to 6. For nasal for oxygen O2 mask, maintain it from 6 to 10 liters per minute, and for non-breather mask, that is O2 bag along with it, maintain the oxygen flow rate in between 10 to 15 liters per minute. So I hope this will be very much helpful. And okay, that's all for today. All have a good day. Thank you very much for listening me out. Okay, now take care. Bye bye.